Hello, my name is Milton Little. I'm the President and CEO of the United Way of Greater Atlanta, and I'd like to welcome you to this afternoon session. I want to welcome our panelists and thank them for stepping forward and participating today. I also want to welcome and thank my fellow roundtable members. And I also want to thank every member of the audience who's watching online. If you want to tweet about this, go to hashtag #PopHealthRT. And we'll get started. We've got a great conversation today with some really wonderful people who've got lots to offer. But before we get into the deep conversation about COVID and the social sector, I'd like to start with a question and then ask everyone to introduce themselves, and then we'll come back to a statement that I'd like them to make about sort of what they're doing right now to stay grounded. The question I always hear is, who cares for the caregivers? And that may be an appropriate question for today. So again, I'm Milton Little, President and CEO of United Way of Greater Atlanta. And I'd like to introduce Cathy Baase, and then we'll introduce Susan Dreyfus, Jason Purnell, and Gary Gunderson. I'll ask each one to give name, title, and their affiliation, and then say, what are you doing to stay grounded? Cathy?
Hi, everyone. I'm Cathy Baase. I'm a family physician and currently the board chair for the Michigan Health Improvement Alliance, which is a backbone collective impact organization operating in central Michigan since 2007. And what do I do to stay grounded? I have to say that I think in all honesty, there's moments when I feel more grounded than others. And there's times when even I could get overwhelmed by sort of feeling there's an awful lot going on that's challenging right now. But what keeps me grounded is my colleagues, friends, and family, and just being able to have some like-minded individuals and the journey we're on, and recognizing just how important it is and how it matters now more than ever. So that's it.
Hi, everyone. My name is Susan Dreyfus, and I have the honor of serving as CEO of the Alliance for Strong Families and Communities. And what keeps me grounded? Two quick things. One is a morning walk with my dog before sunrise. That just is beautiful when that sun starts to peek out, and it just is a very reflective, prayerful, and alone time that I have every day. What also is keeping me grounded is the work of the Alliance to ensure the strength and resiliency and influence of America's social sector. And I really think this is our moment. So that keeps me grounded as well, just staying in the work.
Hi, I'm Jason Purnell, going into week 4 as Vice President for Community Health Improvement for BJC Healthcare here in St. Louis, and also an Associate Professor in the Brown School at Washington University in St. Louis. Like Susan, I've been taking daily walks, playing with my 8 and 10-year-old and making sure to make time for family, and also curating a Spotify playlist with one of my friends where we're adding our favorite songs, which has been cool for the last 6 months or so.
Hey, Gary Gunderson here. I'm Vice President for Faith Health at Wake Forest Baptist Health in Winston-Salem. For grounding, I'm thinking this is the social sector panel. I'm a beekeeper, and there are 2 hives with probably about 80,000 bees, about 30 feet from my keyboard right now. And this is an amazing time to watch these extraordinary social creatures find their way in the world. And I like to go out and sit and watch them. And it kind of says, if they can figure it out, maybe we can figure it out.
Thank you. I offered this and didn't even share my own. I've been spending a lot of time meditating, cooking, and I went back to learning Spanish again. So I've been doing some online Spanish classes just to try to keep myself grounded. And I hope everyone in the audience has found something that is doing the very same for them. I'd like to kick off today's discussion with a question, and that is, for each panelist, what are you most, or what do you feel is the most significant accomplishment of the social sector during this time of dual pandemics, COVID-19 as well as the racial unrest? Maybe we'll start with the beekeeper, Gary.
Well, thank you, Milton. So my comment would be, we're actually great at the social part of the social sector. Right now, the social sector is viewed as a delivery mechanism for medically indicated little bits of services for people who present as health problems with health risks. And I would suggest that's a dramatic miscasting of what the social sector actually is, where we came from, how we function, why we're so adaptive, why we're able to shift from hurricanes to viral phenomenon in a blink. It's the social nature of the creative process by which communities adapt to unpredictable threats and some threats that are very predictable, but maybe submerged in our political consciousness. So I think the thing we're best at is actually social adaptation, and we ought to talk more about that and less about our efficiency as a delivery mechanism.
Cathy?
Hi. I'm not sure that it's really known yet, everything that the social sector has accomplished in COVID. We're only sort of 9 months into this, so I'm not sure the sort of definitive insight is out there. But my observation right now is the social sector has an incredible ability to connect and to connect lots of parties together, and to be clear on the mission of service, and to sort of be able to unite people under a shared mission, and maybe even in unprecedented ways through this, and finding the way to capitalize on this crisis time to create insight that maybe they've been trying to create for some time, but it's capturing the window effectively of the nature of the importance of some things that maybe weren't quite as under the bright light as they are right now, and creating allies to make progress on that.
Susan, you've got a very unique perspective on these. What's your thought on the most significant accomplishment of the sector under these trying times?
I want to, first of all, agree with all my panelists, just reminding the audience that who I represent are America's community-based human service organizations. These are multi-service organizations, and there's nothing in the alphabet of human services that these organizations don't quote unquote provide. This pandemic has given our country an insight into the larger role this sector plays with and in community, as Gary said, beyond service delivery. So I would tell you, in addition to the other things my panelists have said, the thing that I have enjoyed watching is this sector step up its influence, to step up making sure that the voice of the voiceless are being heard, to step up in the issues of systemic racism and the unrest in their communities, and having a role in that work. So I am most impressed with what I think is the paramount responsibility of the social sector, the organizations I represent, and that is our advocacy, our influence. And I think our country is seeing that in a way that I'm afraid I don't think it was as visible as it needed to be. So that's made me very proud.
Jason, thoughts?
I would echo what a number of other people have said. I think if I would point to anything, it would be the level of collaboration in this time of crisis, which I think has been in some ways unprecedented, just because of the scale and scope and nature of the current crisis. People putting aside their individual organizational agendas, really coming together to work for a common cause. And I would put a spin on what Susan said in terms of commitment to racial equity, I think not just in community, but organizations taking a look at themselves and saying, what kind of capacity do we have to actually address racial equity and systems change and inclusion within our own organizations. I've seen more of that.
So picking up on that, Jason, and also on what Susan said, what challenges do you think the sector faces that have been brought into sharp relief in light of these dueling pandemics that we're facing?
Well, there's no question that the vulnerability from a financial standpoint, and the ability for the social sector and many of the organizations to remain financially viable has certainly been one of the key challenges. And we're talking about what organizations will be able to withstand and continue to exist on the other side of this, and not just from a funding standpoint, but really, being able to operate services in a traditional way when many have had to move to technology-mediated modes of service delivery. Just the very existential ability to exist, I think, is one of those key challenges.
I would follow up on that and say I think what's really important is to understand how critical the unrestricted dollars are to these organizations, the dollars that they are able to raise. Their contracts do not fully fund their cost of delivery. Many of the capacities they need, their grants and contracts do not fund. And so those unrestricted dollars are hugely important. We're seeing a reduction in charitable giving in some areas, which is troubling. But remember, this was the first year the sector started its adaptation to the loss of the charitable deduction for non-itemizers. And that was a huge loss. So it just got compounded. So that's probably my biggest concern, is that in this already chronically underfunded reality that the sector lives in, this current stress level on unrestricted giving that they're facing is quite significant.
Well, Susan, you make an important point. In Georgia, we did a survey of nonprofits. Most of them had less than 3 months reserves before COVID hit. And so the issues related to just ongoing financial stability have been only accelerated under COVID. And I think there's a distinction that's made between the social sector organizations that are in the health space with Medicaid and other payers providing revenue to those organizations, and then the typical nonprofit organization whose revenue is 55 or 60% individual donations. And so we've got to look at these two parts of the sector quite differently. Gary, what's your thinking about that?
Yeah, I wanted to speak to sort of the ecology out of which the social sector has emerged. And in the history of the United States, an enormous number of the social sector organizations actually began as the idea of some church committee or some synagogue committee or some group of Muslim docs who wanted to express their volunteer virtue for the poor. The best guidance we have is we have roughly 250,000 congregations in the United States that are often the point of first call when someone has some crisis in their family. They often reach to those faith institutions. Well, those the best guess is that we're going to lose about 20% of those institutions over the next couple years. These are overwhelmingly social structures, and they can't meet. And so and many of them are like poorly funded, not-for-profit organizations that are really going to be at the end of their rope financially and probably close. So part of the challenge is, where does the generative energy come from to reinvent, to regenerate the next generation of the social sector? And the I'm certain we'll still have a very vibrant faith sector in the United States, and it will be part of that answer. But it's going to be part of the uncertainty about how exactly the durable compassion that is common in every American community, how exactly does that plumbing get reinvented so that the organizations called the social sector actually have what they need in order to express that compassion to other citizens, other members, other neighbors.
That connection to faith is key. When United Way started in Denver in 1887, 3 of the 4 people who started it were clergy. Cathy, your thoughts on this?
Oh, I support all of the comments, and so the strain on the sustainability is there, but it's only in the face of even greater need that's also arising. So it's just really compounded because there's always been a challenge for sustainability, and now we've got an acceleration and a magnification of need for those social services on many, many fronts. And so I think it's going to call on the social sector to find some innovation amongst themselves as well, and to pursue. So that might be even greater collaboration, maybe consolidation, even in some cases from certain organizations, and a pursuit of funding in a very different way. And that's going to tap new sources of funding and financing that maybe haven't been fully harnessed in the past. I think there's gonna, necessity is the mother of invention, and we're facing some necessity here, and will need to be some innovation.
I would agree with that. The Alliance recently did a report called A National Imperative, Joining Forces to Strengthen Human Services in America. And there's 211,000 community-based human service organizations in the country. And you're right, Cathy, the sector has work to do. There needs to be greater consolidation. There needs to be greater collaboration. There needs to be more efficiency. There is no doubt that that's a part of it. But I think another big part of it, though, is our nation. And I this is one of my reflective moments that you asked about, keeping grounded in the morning, is why I stay so hopeful, is the pandemic is putting a spotlight on what all the research and other nations with better health outcomes than we have know. And that is the environment and social determinants of health are the biggest predictor of your health and my health than what happens with our primary care. And so I think what also has to happen is our nation is going to have to recalibrate from a funding standpoint. We're putting all of our money into prisons and all of our money into the deep end of the systems. And we have got to start taking a longer term view. If we're serious about population health and our people being our greatest asset as a nation in all ways, we've got to start making an investment in these critical, and it's not just services, because remember, a lot of this is about, I know there's standard of care in healthcare. I believe in our sector, our key to this is our standard of engagement, the way we engage with people, right? To make critical changes in their lives, to connect them with resources, to build assets, et cetera. So I think we also have some work to do as a nation about what we value in terms of the health and well-being of our people.
Jason, let me ask you about that, because, as a healthcare, there's ways to pay the providers. For many in the social sector, their way to pay is to beg somebody for money. But in this environment, we've seen the essential nature of the organizations that are delivering services. How much of the onus on changing is theirs, given the capital structure for the social sector?
Yeah, I wanted to piggyback on what Susan just said and give it a big amen. I was just reading a couple of analyses in Health Affairs showing that when you do international comparisons, you look at the ratio of healthcare spending to social service spending, those countries that have a positive net spend on social services have better health outcomes. Similar analyses when you look state by state. Those states that spend more on social services and public health, which we also have to talk about, relative to healthcare have better health outcomes. So it's not just the social sector that needs to up its game. There also needs to be greater advocacy for the amount of money that gets spent on social services in the social sector by government as a society if we actually want better health outcomes. And we spend far and away, it's 18-19% of GDP on healthcare right now, and have fair to middling to poor health outcomes to show for it when you look at our wealthy peers. So I'm in total agreement that I think the advocacy needs to get even more robust, and we need to start making that case with these data that show what the health outcomes look like.
I think the only that's going to happen, though, is when healthcare and the social sector are sitting in front of the same congressional panel, advocating with one another. I think we're missing a conversation between healthcare and the social sector, and a piece of that is we've got to combine forces in advocating for the system that we want to see that produces population health for our neighbors.
Absolutely.
Gary?
Let me comment a little bit, Milton. My day job is vice president of a healthcare organization in very similar role that Jason carries. And I'll tell you that we're still at a very primitive stage. And one of our challenges within healthcare is we have all agreed with the idea of social determinants without actually understanding the social nature of those dynamic processes. And so we sort of think of social determinants as another set of things that we have to include in our reimbursement contracts, and we need another set of providers who are good at that social stuff. And we just need a much more radically fundamental rethought of what is social, what is health. And I don't think any of us have yet mentioned the profound dynamics visible within COVID of the role of anxiety and depression and social isolation, all of those pathologies. And we haven't emphasized enough looking for where the positive, generative social dynamics are in the community. So I think we need whole new business models. This split between not-for-profit and for-profit is tripping us up. And we need to move, and I believe the social sector could change the dialogue more rapidly by moving into new risk-based agreements, profit sharing, gain sharing, risk sharing with some of the healthcare organizations. The social sector understands the social dynamics of people's lives. And this is not something hospitals has ever really had to know, and so we don't know. But the partnership around the intelligence of the social dynamics is something that could transform our business models.
Cathy?
I just wanted to jump in there because I don't think it's these deep and intractable challenges that we're all talking about, that it's not one sector that's going to, the truth is that there is a role and a necessity for all sectors to contribute to the solution. And so the social sector is a really vital sector. And our contribution as a social sector in collaboration with other sectors like healthcare, which might be in somebody's book, the part of the social sector as well, but the private sector community. And, to me, the collective aha of the country has got to be that we really all have a stake in this and all sectors need to work together. But hopefully that generates a deeper appreciation and value and connectivity to the social sector.
So, Susan, you think that's going to happen? I mean, you can tell how much people value things by how much they're willing to pay for it. The social sector may be critical, but it's never been viewed as an equal in that grouping of really catalytic organizations around the kind of change we're talking about. Well,
I'm going to surprise you all and tell you that I'm 63 years old. I have there's probably not a part of the human services system I've not run, and whether for a Republican governor or a Democrat governor. And I have to tell you, I've never been more hopeful in my career. And I know that shocks people, but I sincerely, and I am not Pollyannish. I understand the intensity of the issues we're about. If there's something good that can come out of the horrors of this pandemic, right? It's that it has put a spotlight on health inequity. And when we get underneath the root causes of that, and one of the things that's been the problem I've had with healthcare reform up until now is it's been about care coordination. And if Susan Dreyfus patient needs food, then I'm going to write a prescription for her food. If someone needs help with their rent, I'm going to help them get their rent. That's all well and good. But my problem is that I think that we have the opportunity to correct is our nation. I feel like I'm watching for sometimes, Milton, stuff we were talking about 25 years ago, we're still talking about today. And it's because we keep making the fundamental attribution error. We keep thinking if we just focus on the person and have done nothing to change the context within which they live their lives every day. And we know through the adverse childhood experiences science now, and what the Harvard Center for the Developing Child has helped us understand about toxic stress and what that does, right, to our development that lasts for a lifetime. I think this focus on the health inequities and the root causes of it are going to move us away from thinking this is about better care coordination, and that we've got to change context of in which people live their lives. And then the double whammy that makes me hopeful is now it's put the focus on systemic racism, because those things are interrelated, right? The health inequities we're seeing, to me, I hate to say it, but are sitting in a lot of the systemic racism that we have as a nation and our own bias and misunderstanding of root causation of what causes people to have that appear, to be at great risk. So I'm very hopeful that we're just sitting at a historic moment. And I think we're going to be judged on this one. Whether those of us in this work really rose up and did more than just provide a lot of services, but we started changing context of neighborhoods and communities.
Anyone else have a comment on this before we go to a question that was submitted by a member of the audience that would take us in a slightly different direction?
Yeah, just briefly, I don't want to rain on Susan's hope, but I don't think it's going to be sufficient just to present data about health inequity or to have greater consciousness about systemic racism. We've got to make the case for why this is necessary from an economic competitiveness standpoint, from the vantage point of being a viable economy, a viable democracy. We've got to frame this as the kind of existential challenge that it is, because frankly, I'm not convinced that doing things because they're the right thing to do are going to carry the day unless they also make some economic sense and are part of a broader strategy around the nation's viability.
Anyone want to comment on that? Gary? You look
So I just want to restate, as long as we are arguing about prioritizing which pathology to fix, there's not going to be enough generative energy or resources to go around. And I'm looking at an unpublished paper from Heather Wood-Iron, who worked with Jonas Salk around the idea of epidemic of health. And she comments, as long as realities such as homelessness and trauma are defined as medical issues or health issues to be treated by a healthcare system, or she would say a social system, the conditions of life are defined as contributing adverse risks. In other words, social determinants are almost always negative in our conversation. And then we argue over which problem is more important than another problem. She says they require an amelioration or prescription rather than human exploration, understanding, adaptation. And in the context of the fundamental sin at the heart of the American experiment, racism. Liberation is the word that's often missing from our agenda. And I don't think you get the liberation by just fixing it like a problem. You do it by releasing the human potentials that are common in our communities. Well, this sounds like, just sort of kumbaya, but it's the heart of John Lewis. It's the heart of Dr. Martin Luther King. It's the heart of the change makers in our society to do the right thing at large scale. And they didn't just fix problems. They released the positive energy of our people.
Absolutely. So a question that we're seeing in the chat from our audience is, we're seeing citizens being overwhelmed with information, much of it incorrect. There's a need to bridge the information known by the science community and the understanding of individuals and families and local communities. Do you see a role in influencing the narrative and transforming it into potential programs? Who wants to take a shot at that?
Well, I'll give it a start. From my perspective, what helps, the role we can play is the telling of stories and people telling their own story, people being the authors of their own story. And I think one of the things that our sector has been working on through all of this is to ensure that people are not just numbers, but but seeing their humanity. They have a name, they have a face, they have a life, they have hopes, dreams, desires. I love Gary's idea here. We've got to build assets in our nation. So the way I look at this, from, again, as Cathy said, this is about all of us, not just one sector is going to carry the day here. I think a big place our sector plays is putting a human face and life to the story. Because I think that is something that it's very hard to simply walk away through political division when you actually have the ability to see a person's humanity right in front of you. And I think that's a role that our sector plays. And I'm watching more of that happening, which is good to see.
So Cathy, I'm going to pick on you, because we're living in a world in which we are easily demonizing our fellow Americans. It's easy to just think folk unworthy. And despite, what shows up in the news, how many times we see another Black man getting beaten, how many times they tell us to wear a mask. We've got folks who just don't buy what they see and are never getting out of their own sort of personal sort of mindset to embrace a broader sort of sensibility, as Gary's talking about. Your thoughts?
Yeah, I was thinking about this throughout the last half an hour, where we were talking about one of the greatest progress points for the social sector is their ability to collaborate and unite. And yet, one of the most profound challenges we seem to be having is division in society right now. And so if we think that's one of the strengths, and I do, of is the ability to create common ground, to find that common ground, and to bring people together around a collective mission, then I think that the social sector has a really unique and valuable role to be playing. And I think it's easier to do at the grassroots level than it is when you're at the sort of national political agenda, even though that matters. But I think getting people to a space of listening and thinking and collaborating with each other and being willing to entertain their common good and their needs happens at the grassroots level, and by at least pursuing that in a widespread scaled manner and sort of building things from the grassroots is one point of hope. And I think really offering to listen, and the basics of Our Community Listens, or the basics that are used in collective impact to sort of rise above the fray a bit and bring people together on what can we do together, and begin to, so that people begin to experience the humanity of us all and appreciate and value each other differently. It's really troubling, but to not let division be the paradigm under which we're operating, and rather seek for unity pathways for us. What can we work together on, kind of thing.
Jason, you see the common good still having currency in the face of these dual pandemics?
I do. I recur, so I'm a psychologist by training, so I think a lot about human behavior. And social categorization is not a bug of human psychology, it's a feature. It's going to be with us. It's part of how we understand the world. Asking a member of an in-group to value a member of the out-group as much as they value that other member of the in-group is a tall order. But if you can redraw the boundaries of the in-group and come to a bigger us, you've got more of a shot at that. And I think what Cathy says, particularly about doing things together, not how do I convince you to agree with me, not how do I get you to say the right words or call me the right thing, but what do we actually do together that helps us advance some sort of common goal, is how you break down those barriers between those groups. And I think that is what's hopeful about this moment. It is what Gary's talking about in terms of neighbors coming together. But I caution us against thinking that we're somehow going to eradicate social categorization from the human psyche. That's not how this is going to work. But I do think there's an opportunity, a real opportunity in this moment to rethink who gets included in American, who all is part of this common in-group, and what can we do together? I think that's the absolute right question.
And Jason, earlier you were talking about it's not going to be just by some altruistic vision, that there's a business case or an economic case that's really valuable here. And I just wanted to lift that up again. I agree, it's both. It's our common good and our common ground in doing those things. And I think having a way to continue to have the drumbeat of the economic case is valuable.
So, Milton, I have to say, as I think I'm the only ordained member of the panel. Faith communities, I've been stressing, are part of the assets and generative. I worked for President Carter and Rosalind Carter for some years, and Rosalind Carter, whose primary work was around the challenges of people living with mental challenges, and she used to say that the faith community's first word in the public sector should be apology. That we have been the last bastion of the most disabling stigmas that persist over time. And the same could be true about numerous things. And I'll pick up on Jason's critical insight that it's the behavior of creating a relationship across a boundary, which we've been told is a boundary we can't cross. Very few pastors actually know their public health director by name. They've never had coffee with them. And so when some totally unpredictable crisis happens, a pandemic, they don't have that relationship to call up and say, Joshua, that's the name of our public health director. Joshua, what the heck is this about? What should we do? What do I need to be telling my members? Can you help me? What's this about all these masks? Should we, shouldn't we? What's up? And by the way, what about this bleach thing? If you don't have a relationship with someone who has complementary intelligence in you, you're really trapped inside your own echo chamber. And I think this is a critical task. Faith communities need to apologize for being tribal, and we need to visibly, publicly cross over boundaries, create relationships of dialogue so that we can learn our way into this moment.
Gary, I want to put a pin in that too, because I don't think it's just clergy's responsibility. I go back to my public sector days, and when I was the administrator of children and families for the state of Wisconsin, I created the first faith-based advisory group. I met with on a regular basis to have their insights, to have that relationship, guidance on key policy issues. I think it goes both ways. I think anybody sitting in a public sector job today has an obligation to understand that community is your greatest asset. You know, not just your vendors and your contractors, but those who make up the fabric of community. And so I think when we think about public sector work 101, a key part of that is having Gary come and talk to new public sector folks about the critical role that they also play in bridging that divide and creating those opportunities for that relationship to occur as part of their work and not tangential to their work. But it's really a great point you make.
Cathy, a question came into the chat directed at you, but something I think everybody can weigh in on, and that's, would you kindly explain further your thinking about what might be more innovative ways for sustainable funding support for the kind of collaborations, including the social sector, that you think are essential for us to move forward from this point where we are right now?
Sure. I am in the midst of working on a project on that right now with others. And the idea is that we have as a community, the portfolio of things we think are the priority to improve the health and well-being of our citizens, addressing gaps and overcoming barriers of scale and sustainability that seem to be common issues for everybody. It seems like almost all communities face that. You have lots of passionate, brilliant people and organizations doing good things, but it's never enough to overcome the magnitude of the challenge that they're addressing. So we're inadequate in terms of scale and cyclic in terms of sustainability and all of those things, and lacking in coordination with the partners that are necessary for highest impact. So thinking about the scale and sustainability, I've looked at the construct of a funding and financing utility that could serve at the level of the community, which matches priority work that needs to be done and the set of funding and financing sources. And those funding and financing sources exist today, but dominantly communities use grant funding and so many of the pieces of work or individual philanthropy, as you called out earlier. And yet there are other streams of resources that exist that have not necessarily been harnessed and deployed against that work. And I'm speaking of things like Community Reinvestment Act dollars. Yes, they're being spent and they're being used, but they aren't necessarily being tied to a plan of work from the social sector or informed by planning from the social sector. And so using that, looking at block grants, looking at community benefit dollars, the deployment and investment of the reserves dollars, as Gary will and remind us that the health systems have and anchor institution work in general, the capacity of the business community, and looking at corporate philanthropy and sustainability, not just foundation dollars directly. There's a litany of these 30 or 40 different types of funding that do exist that in many ways are sustainable in a very different way from grant funding. I'm not suggesting grant funding is bad or people shouldn't use it. They should, but bringing investment, capital into the picture, bringing all of these in an orchestrated way so that everybody's impact is greater. And certainly the people with all of those fund sources want them to have an impact. and yet they're not always, like I say, orchestrated or harnessed. So if you have a community improvement plan, how is there a matching phenomena of all the sources of funding and financing that could be utilized to fuel that work? And so that's exactly the project that we're working on and prototyping that in the community right now.
That's very exciting. Cathy, Susan, you've been at the state level. You've seen all kinds of efforts probably to braid funding together. Thoughts on this?
It's interesting for me. I agree with everything Cathy said, is that in human services, we've been doing this for a long time. If you look at what is true wraparound, it is a case rate, and it is the blending and braiding of multiple funding. Wisconsin's family care, that is the blending and braiding of multiple funding streams, including Medicaid and Medicare, for high-cost, high-need utilizers across a myriad of issues: developmental disabilities, aging, long-term care. And we know that what it is it's paying for results and understanding that without margin, there is no mission. So Milwaukee County and their wraparound program in the juvenile justice, children's mental health area nets about $1 million a year into the county budget. There is nothing wrong with that. I think a big part of this is we've got to, as a nation, understand that what my sector wants right now, these human service organizations, pay us for results. Just as you fully fund road builders to build a mile of road, and you don't tell them to do it at 80 cents on the dollar, meet all the standards, but we're only going to pay you 80 cents on the dollar. No road builder is going to build any stretch of road for anybody. But yet we do it all the time as a sector. So I'm going to say the other tough love piece here, and that is, as a sector, we've got to start saying no. Because this starvation cycle, as Gary was saying earlier, all it does is we start to bring down our programs and services, which I think ethically, morally is just the wrong thing for us to be doing. Or we end up in a situation where we just simply no longer can exist. So I just think it's time to really understand that this blending and braiding of funding is happening now. We just need to start scaling it up. I agree with Cathy, though, there does need to be some way of attaching this sector to a capital market that does not exist today. But the full funding of what we're doing, making sure we understand without margin there is no mission, and the sector standing up when people are wanting us to do things at 50 cents on the dollar to simply say, no, we think more of the neighbors we serve and the value of our work, and we are simply no longer going to agree to do this. Because as long as we keep doing it, right, then to anybody that's funding this stuff, it's like, what's the problem? So it's a very complicated issue, complicated answers, but I do think it's solvable.
One of the folks in the audience has called it the social integration highway and wants to know why government doesn't do more of the kind of funding that you talked about. Susan, Jason, Gary, a thought on that?
I'm going back to this notion of narrative and stories, and Gary's, reminding us of the history of the social sector, I think is relevant here, because we're still operating under this notion of the deserving poor. We're still operating under notions of poor laws in England several centuries ago, and not seeing these as the investments they are in human potential, but seeing this as leftover work, charity work, work on behalf of people who don't deserve this because they made poor choices. And I think that narrative has become the dominant narrative. So why would I pay you dollar for dollar what it costs to do your service when I believe the population you're serving doesn't deserve it, because, they didn't sufficiently pull themselves up by those bootstraps. And that you can't underestimate the power of that story, so that you make investments. I say all the time, you don't invest in problems. You invest in resources. You invest with a hope for a return. But if you see people as throwaways, if you see people as not contributing, if you don't see that human potential in them, you're not going to invest. And that runs deep in our culture. This notion that these individuals who have not been shaped in any way by their context, but are just, totally bootstrapping, and that explains their life outcomes, I think is the reason why we don't see a more robust role for government.
I think there was some echo of that in the discussion around whether $600 added to unemployment was a disincentive to work. And the prevailing narrative was it was, and we ought not do that. So, Gary, he invoked your name.
Yeah, let me follow up on a couple of things Cathy alluded to, because I've been part of some of the creative provocation of her amazing weaving in Michigan, of trying to identify where actually are all the assets and how could we redo the relationships between what right now are locked pool of assets. One of those, current law, community benefit law, views hospitals purely as clinical operations. And so we have been now held accountable for more transparency about the not-for-profit margin that hospitals produce, and that margin is now more and more accountable to a public health sort of paradigm of benefiting the community. But community benefit law does not require hospitals to disclose our days of cash on hand, or our investable corpus, our endowments. And so most hospital operations now really are running two businesses. We function like a clinical operation that runs on a narrow margin. We're able to run that hospital on a narrow margin, partly because, in effect, we have a bank. We have a couple hundred days of cash on hand for most really well-run, stable hospitals. Well, that investable corpus is not accountable to the community. If we had that much cash and I was running a bank in Atlanta, you would know exactly where I lent that money locally, and I would be accountable for investing in a proactive manner in formerly redlined communities, or I couldn't continue as a bank. Well, hospitals of Atlanta are not required to do that, or in Winston-Salem. And so when we talk about crafting new business models, one of the critical things that have to happen is much greater transparency about the current business models, so that we can see, well, what would be the fair, appropriate relationship between United Way and the social sector of Winston-Salem and the dominant industries in our city, are two large not-for-profit healthcare organizations. Well, we can't really redesign the business model of the social sector without a lot more transparency on the table between the other sectors there. Then we could see who was actually producing the value, who ought to participate in that value in terms of better lives that are lived without as much expensive healthcare intervention. You'd begin to actually value the social sector in a radically different manner. But without transparency, we're really just sort of talking in the dark.
So I'd like to go back to a theme that was in one of Susan's thoughts, and that was how this moment has revealed for the broader community issues related to health disparities and a host of others. What do you think the sector can do to educate funders, both public and private, and individuals, as well as the general public, around these issues of equity, around these issues around disproportionate impact, in a way that might truly galvanize policy and philanthropy, so that we can get done what we need to get done to create more justice and fairness on the other side of these two pandemics? Susan, thought?
Yeah, I think of what Jason talked about in terms of organizations when he said, that he's seeing organizations who are really having their own equity, diversity, and inclusion journey. I know for me, what's happened over the past months is I've been having sometimes very tearful times alone with myself about how I have been complicit as a national leader, and in terms of our advocacy work, but also as a former public sector work person running these myriad of systems. I say, oh, patient, heal thyself. I don't think our sector can bring its best self to the table until we have that painful journey. And it is a journey. It's something that we can absolutely go on. I'll give you an example. An organization in upstate New York, Villa of Hope, started having this journey themselves, and they started looking at their data. And they started realizing that they were putting children of color into one category and children predominantly white into another category in decisions that they were making. And when they peeled it away and they started looking at it, they couldn't hide away from the fact that there was clear implicit bias there. This is an organization who is awake, right? They are truly serious now about this journey. And so they were just very upfront with it. This is happening. What do we do to fix it? And we've been working with them at the Alliance on that. So I think it's just really important that before we're thinking we're trying to fix policy and everybody else, I think every one of us as individuals and as organizations have got to ask ourselves, how are we in any way being complicit in this issue? And because I can tell you, Milton, having run 2 state child welfare systems, you want to talk about a system that is fundamentally rooted in some of the past beliefs held around slavery. As I've been working on my own personal journey these past 6 months, it is painful. It is a painful reality. Look at our corrections system as a nation. So until we do that, I don't know, we should be out there trying to fix everybody else. I think we've got some work to do ourselves.
Gotcha. Cathy, a thought?
Yeah, I was being very sort of pragmatic and thinking about how we do this, like real tangible things. And I think there's conversation and listening and hosting and facilitating that kind of activity. In the organization, Mahaya, that I'm the board chair of, we've earlier this year put out a strong statement that was after some serious deliberation on our principles and positions, and a set of commitments made, not just a statement, but a set of commitments. And some of those included things like changing the mix of our board and changing the way that we do work and the way that we include whose voices are at the table in all decision making, and how we convene leadership teams and what those processes are. So I think it's conversation, experiences that are set up, and inclusiveness approaches and more transparency. And another example, a great thing, Rishi Manchandra and Health Begins is doing is, even as physicians, he's got this work going across the country about how one of the approaches to addressing health of your patients is encouraging them to vote, and even registering people to vote at the clinic. I mean, that's the kind of innovative thinking of bringing voice and agency to a population, because it will change their health outcomes. So I think we can, on this journey, there's a lot of learning to be had. And I think there's very practical and tangible actions that can be taken as well, that if they're intentional and authentic, do bring change.
There are similar efforts in Atlanta, Cathy, that are focused around the census, making sure that folks will complete the census as they sit in a clinic waiting for service. Jason, a thought on how we do this?
I think one of the most direct ways we do this is change the paradigm from serving and acting on behalf of community to acting with community. Having actual, robust, reliable conduits to the lived experience of people in community, valuing that, recognizing that the agency and the voice is already there, creating more connections, and frankly, less skittishness among the nonprofit sector towards advocacy and activism, but also creating those connections with advocacy and activist organizations who have the relationships and have the tools and have the techniques for really understanding what community is demanding, which is a different way of doing business than to say, we're going to do our needs assessment or we're going to do our focus group and we're going to ask, this hand-picked group of people that we've defined as representative of the community to tell us what you need, rather than working with community and listening to what you demand. That's a totally different frame of mind and frame of reference, and it requires an openness. And I like that, Cathy's mentioned multiple times listening. Sometimes you need to don't act, just sit and listen. And listen with intention, and listen in ways, build the infrastructure to listen. So it's not just a set of episodic activities that we do on some sort of predetermined schedule, but there's actual intentional relationship that goes beyond, board diversity and some other efforts at what we call inclusion, to actually, and let's frankly compensate community members for their role in telling us what's happening in the community. I very often use the analogy in industry. Some people may not like that, but in industries like fashion and design, there are people who are paid to be trend spotters. They're looking for the next thing that's going to give that company some competitive advantage. But when we very often design social solutions, it's in a vacuum, it's in a tower. We're not engaging in what a company like Apple would call the end user. We're not doing that in sophisticated ways with feedback loops that are really designed around that lived experience of the person who's going to receive whatever the program or service is. I think that's a critical way, and it crystallizes issues for you really quickly. I've been in meetings about gun violence and violence prevention, and I've said to the people in the room, I wish we had somebody in this room who hears gunshots every night, who's had family members and friends shot and killed. That would crystallize this conversation beyond what committee should we have and what should our strategic plan be, in a way that might accelerate and improve upon the kinds of interventions that we're designing, because it's based on the actual lived experience.
I just want to say yay to Jason. That was so beautifully stated. I think a big piece of this in our member organizations that use appreciative inquiry with resident at the center is the really hard part about this, though, too, is when we ask the question and we understand what the residents, our neighbors, are saying they desire, their hopes, dreams, desires, and what works. Are we willing to say no when we are asked to take funding, right, that is not hitting the bullseye of what works? So Baker Ripley down in Houston, Texas, using appreciative inquiry, and they really have the courage when they are being asked by funders to do things that they know are not what the neighbors are telling them they need, want, desire, and works, to say, no, thank you. So anyway, just to put a pin in what Jason said, but also the tough part of that is, are we willing to stop doing what we are historically asked to do when residents tell us that is not what they need or desire?
But aren't we also, well, not but, and it seems we're also saying that the conversation ought to flow up to the funders as well, so that they get the benefit of that lived experience and will shift how they program and the kinds of outcomes that they're looking for. I see heads nod.
You know, a great example in real time, our hospital here in Winston, I mean, we got gazoodle tons of data, and we were trying to prioritize where actually should we come to ground and do the right thing over time. And about 400 yards from one of our churches that we work with the most is the epicenter. If you draw a 1.25 mile radius around that, you have a couple 100,000 people. And, you know, they embody all of the disparities and systemic patterns of wrongdoing over 100 years. And so we went, and this is a well-organized set of neighborhoods with organizations who've been doing varieties of assets mapping and appreciative inquiry for some time. And we basically, some of us went and sat down and listened. We didn't have to create the venues. We just had to show up and shut up and listen. Well, we assumed that, you know, what they'd want is clinical stuff. And we're really good at clinical stuff. And so we were assuming we'd be dealing with requests for a clinic on the corner, and maybe we need another mobile van and this and that. What they actually wanted, the presenting challenge that they were most painfully aware of, was living in a food desert. And they even knew how to grow the tomatoes. They didn't need us to bring in a box of tomatoes. But at one point they said, you know, where are you buying the food for your kitchen? You actually have one of the biggest commercial kitchens in the city. Would you be willing to contract with us so that we can get out of these little 100-foot square neighborhood gardens into something more like cooperatives that could participate? And, you know, they were saying, we need access to your market as a commercial buyer of supplies, so that as neighbors, we could actually create the supplies and thereby feed our own neighborhood too. You know, it was like a mind bender, because well, sure wish you'd asked for a doctor, you know, because it was a whole different part of our organization who normally is never part of community dialogue. And, you know, the folks of us who live on the pop health, community health, faith health side, well, we're not in the revenue cycle. We don't figure out who the buyers of our kitchens are. Well, it forces us to bring some of our internal colleagues into dialogues that they don't think have anything to do with their day jobs. So it actually is more disorienting and disruptive of the business operations, because there are tons of folks on the revenue cycle who are good, decent people. They just have never been asked to show up and themselves come and listen to how could that part of our medical industry be part of the emergence of healthier communities. I'm just sort of underlining what Jason's saying about listening. It's also critical that we broaden the menu of who is listening, so that the assets that are brought to that intentional listening process make view to the community the full, rich array of potential relationships that are there to ask for. So we were lucky that we had some really smart people in that one meeting, and it's probably going to blow the minds of our organization as we go forward. But nobody in our organization is going to say no to that. It's actually an invitation towards relevance across the broader part of our organization that wouldn't be there otherwise.
So there's
I want to link that back to.
I'm sorry. Go ahead.
I just want to link back Gary's comment to something we talked about earlier in the funding and financing sort of arena. And this has to do with policy. And there's the organizational policy, like he's talking about, how do they operate their businesses in the community and what kinds of procedures and rules do they follow, which does have a huge impact on the flow of resources. And there's regulatory policy, but I think in the social sector, recognizing, as we were talking about, the challenge of resources to make sure we're wrapping in. And I'm sure, as Susan will say, we've been doing this for a long time, but I'm just sort of trying to enlarge the circle of community-based organizational institutional policy as part of this work.
I think these take us to a question that was submitted by a member of the audience, and it goes back, I think, perhaps to something that Susan was talking about when she talked about that adoption agency. But it's, how do you engage decision makers in an organization to take the steps towards having that inner battle to recognize implicit bias and then begin to understand how it affects their practice? Says when you can't get people past the I'm not a racist or I'm not prejudiced mentality, you get stuck places. How do you get them to really decide intentionally they want to take that self-inventory? Susan?
I'm happy to start. I think it's a great question. Because I think a part of this is sometimes for some people, the pathway to get their attention is one of performance, right? You'd like to think people want to do it because it is just absolutely the right thing to do. But I think there's clear data out there now that says that high-performing organizations are high-performing when they get the very best out of the people that work for them and the greatest of diversity that they are honoring in their organization. So I think performance is a compelling argument, but I have to tell you, I'm hard-pressed to believe any organization can be successful with that alone if the leader is not willing to be vulnerable enough to look within themselves as part of the process and to truly take it on. But there's no doubt in my mind, the Alliance has been on an equity journey ourselves for over 4 years. It has been painful for me at times for the feedback that I get, that I have to take seriously and look at changing, myself about. But I will tell you, to watch the performance of the overall team, and it's not like anybody's expecting perfection. It's they want to see the commitment, right, to it. So the only thing I can think of is for organizations that are not there awake enough yet to go through to start the journey. The performance argument is a pretty, straight out argument for why equity, diversity, inclusion in an organization is important. It's just though that we can't think it's about numbers. It is truly about behaviors, and it's truly about actions, and it's more than numbers.
Gary, a thought on this, because those of us in the social sector will say we made an affirmative decision to do this work. We're rich with compassion. How dare you suggest that I may have some bias here that allows me not to listen to the voice of community and not to be thoughtful about how I'm organizing my programs and services and advocating for people?
Well, I think there's so many kinds of diversity today. And sort of my rule of thumb is if none of your friends are embarrassed by any of your friends, you're probably not diverse enough. And the diversity may be political, it may be faith, but it may be racial. You can look in your own daybook and diary and see who you've had lunch with over the last year. And, you ought to go through that and reflect a little bit on, well, how come everybody I've had lunch with looks sort of like me or works for me or has some functional role to satisfy my job? I think somehow we have to look at our own pattern. And everybody on this call, most of the people likely to turn into a National Academies webinar, or probably a leader in some way or another, a position of influence. We ourselves set a highly visible pattern of behavior in who we relate to, who we listen to, who we respect, who we quote, who we hang out with. And frankly, how do we listen to the people who are on the lower paid ranks of our own organizations? We've had a journey at Wake Forest in listening to our own environmental workers who at one financial crisis we almost let go for purposes of efficiency. And at the last moment, we realized, well, good Lord of mercy, these are the only people who actually live in the neighborhoods that are part of our big financial challenge. Maybe we should keep them and turn them into community health workers. And we did that some years ago. And that has been transformational, not just by making our community health work more efficient, but by changing the mind of the organization about where the intelligence lies in the organization, and it lies all across the organization. So I'm just thinking, fundamentally, we have to change our own behavior about who we're listening to, or we're not going to get very far.
Jason, a thought, argument to that?
I looked up a quote from Dr. King, who has a really pragmatic take on this. It says, "It may be true that the law cannot make a man love me, but it can stop him from lynching me." And I think that's pretty important. We don't have time, in my estimation, to change all these hearts and minds in these organizations. But to Susan's notion about performance, I think it has to do with accountability. It has to do with a set of expectations. Your heart and mind might not be changed, but if your grant funding depends on your ability to demonstrate that you've addressed these issues, or if your performance evaluation within an organization and your continued employment depends on your ability to demonstrate outcomes with respect to this, to me, that's the more important thing. I want to see how your behavior changes. And I hope that you reach some enlightenment along the way as well. But to me, that is secondary to whether or not you're getting outcomes that advance equity, that increase opportunity for people who've been left out of opportunity. And maybe I'm getting cynical as I age, but I don't think we have time to change all these hearts and minds. And I'm not optimistic that we will.
So the philanthropic community right now is really being challenged in terms of diversity of its professional staff at the high levels, diversities of the board, and some question of whether or not they are helping or hindering the fight for equity and diversity in not only the sector, but in community. For those funders in the audience, for those colleagues of ours on the roundtable who are in foundations, what's their takeaway from this conversation that may begin to have some influence over their own thinking, decision making, structure of grants, all the stuff that the social sector organizations depend on them for? Cathy, a thought?
Well, just listening to Jason just most recently is fresh on my mind. And I mentioned in my introduction, I'm a family physician and pursued this career because of my deep interest in improving the human condition for individuals and populations. And I started off thinking that everyone must think that way, that all people are inherently motivated about improving the health of all. And sort of in the space where Jason is, I didn't feel there was enough length of time in my lifetime to wait for everybody to come to that conclusion once I realized that not everyone values that more than everything else, and had to learn to make the arguments and the rationale and to build the pathway based upon value and outcomes and the economic case of this to many different parties. And I think we're in that space that the innovation here that we're calling ourselves to has to be some continued discipline about collaboration and about delivering impact and value. I'm just reinforcing what Jason was saying and others throughout this call, that will probably drive us faster than waiting for even though I have tremendous faith in humanity, than for waiting through a collective consciousness change. And I think they're both important, but I think they both, and that we should be pursuing both at the same time.
What do we tell the funding community, Susan?
That you have to understand, you've got to move from program thinking to systems change thinking. One of my frustrations with philanthropy is not enough of them are trying to change things at a systemic level. They want to proliferate programs and services. They want to hit scale and sustainability of programs and services. Don't get me wrong, that's wonderful. But to Jason's point, they're not going far enough into giving us the freedom as a national organization to not just come up with what is the next practice around, blah, 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 whatever you want to, pick the topic to be, but what is it that drives larger systemic change? We're at the point at the Alliance that we will no longer be taking grants if there's not a policy interface to them. If we don't see how the work we're going to do, the knowledge we're going to build, that we're going to be looking across the levers of systems change. How do we change practice? Is it scalable and sustainable? How do we change policy? Little p policy at an organizational level, big P policy at the federal level, state level, right? Local level. But the holy grail of systems change, Milton, in all the years that I've run these systems, is when the regulatory and fiscal mechanisms get aligned to the very practice and policy we believe in. And I don't see philanthropy going far enough, right? We're staying here comfortable with practice. How are we going to quote unquote fix people or get services, scaled up? But what are we doing to change the systems? And then the last thing I'd say is if I were sitting back in my public sector work right now, to Jason's earlier point, I would be absolutely changing my boilerplate of what is it that we're going to scrutinize about organizations that we are going to fund. And one of those would be at this whole issue of how are they truly advancing equity organizationally and in their work, and getting very serious about what's right in front of our faces. And philanthropy has to look at this too. And that is the disproportionality of these systems. I mean, it is just right there. So that's what I would ask of philanthropy, is move from program thinking to systems change thinking, and let those of us in this space move that whole continuum. But we just seem to get pigeonholed into one area of change.
Well, there's a philanthropy session on Thursday, so we'll be able to hand some of this off to them. And to your point, Susan, I'm having conversations in Atlanta about a racial equity and healing fund that we launched. And the question I get from a lot of donors is, what kind of programs are you going to support? And I keep saying, we've got an equity and we got equity challenges in the United States, not because there aren't enough programs. There's all kinds of groundwater stuff we got to be able to cure in order to solve the disparities that are common across criminal justice, education, workforce, housing, health, you name it. And so, yeah, I think it is about systems change. Gary, a thought?
Yeah, as long as the social sector is funded in terms of the categorical problems that we are considered relevant to, we're not going to ever get paid for systems change. And I think we've got to not be part of the pathology. We've got to actually be part of the generative alternative to the current pattern of pathologies. And so we've got to be borrowing intellectual tools from, you mentioned David Cooper-Ryder's an appreciative inquiry, the McKnight assets mapping. I'm enamored with Dr. Sindall and University of Texas, El Paso and the work of positive deviance. We work with a network of fellows around leading causes of life. There's plenty of alternative ways of thinking about what's going on that are relevant to the systems. But as long as we bring the same mental model to changing the systems, it's really not going to be transformed. So we've got to do our own intellectual work, cross some boundaries, and draw from a more diverse range of thought, so that we can change our own brain, change our own mind and spirit, and do the work that really matters over time.
So we've got 5 minutes. So I'll ask folks if they've got a closing comment that they'd like to offer, but I'm going to pick Jason first since his name has come up so many times in the comments of others. Get us started so everybody else can build off what you say as a closing comment.
I don't know about that. This is a strong, lots of strong people, and I've learned a lot during the course of this conversation. The bottom line is I remain hopeful, but I often say that hope is the older, wiser cousin of optimism. Hope sees reality and knows that there's possibility. We've got to be pragmatic. We've got to be clear-eyed. We've got to be strategic. I don't think there is one way of dealing with this. I don't think there's one way of raising awareness of this. It depends on who our audience is. It depends on what we're trying to achieve, but we've got to get much more sophisticated and strategic. And to the earlier point about philanthropy, if you want to see collaboration, if you want to see systems change, you've got to fund organizations in that way, and stop funding individual organizations, to Gary's point, to solve individual problem if what you actually want to see is systems change. So I remain hopeful. I think we've got an opportunity here, but I'm also a student of history, and I know there's nothing inevitable about us seizing that opportunity.
Susan?
I'm going to give you a head and a heart answer. On the head side, as a nation, let's stop talking about healthcare reform as if it is about the practice of healthcare. Let's talk about healthcare reform for population level health. I think we should start every conversation at a population level, right? And keep our eyes there. It's like Jerry talked about generative. Well, I'm going to talk about Ron Heifetz and technical versus adaptive. The adaptive change we say we want to see is not going to be solved with the technical answers about care coordination for people, right? It's going to be at this population level where the adaptive change happens. So I would just change this conversation to be about population level health and what creates that. Because that not only is going to change healthcare, that is going to radically transform human services delivery from deep in to more front end and preventative, where we all want to be. My hard answer is we got to love each other more. We have to start seeing one another's humanity, going out of our ways today at that grocery store to greet one another, to love one another. And I think there is nothing more powerful in our nation when we really start seeing one another's humanity and lean in with love.
Wow. We've got less than a minute. Cathy, Gary, anything you feel compelled to say? I see heads shaking on Gary's part. Cathy?
I'll be very brief. I agree with love is the most powerful force that there is, and call us to that. We've talked all about system change, and I think there's a word that wasn't said, but there's a capacity that's necessary, and funding capacity is important if we're going to get system change. We really need that. And I think we need each other. This field is evolving and changing, and we're learning. And we need to recognize we're in this for the long haul. And those of us that have been in it for a long time need to reach down and bring others along in this field and keep the next generation, committed to this work.
With that, the gavel goes down. Let me thank all of you for an incredibly wonderful conversation, very thoughtful. Thanks to our audience. Thanks to our roundtable members for joining us today. And we look forward to seeing you all real soon.